Welcome to the B&G broadcast. My name is Gabriela Bonavolanta.
And I'm Bailey Ridgway. This just in, the pandemic H1N1 is at an all-time high.
We have shocking new stats and reports of dramatic measures other countries have taken to keep this sickly virus out of their borders.
Join us this afternoon for a full cover of the mysteries behind the upsurge virus. Stay tuned.
This virus has been making its way across the globe for a couple of months now, yet not many people have the full understanding of this crisis.
Swine flu does originate from infected pigs with type A influenza. This cannot normally infect humans.
However, sporadic human infections with influenza viruses that normally circulate in swine and not people have occurred. These viruses are called variant viruses.
Most commonly, human infections with variant viruses occur in people exposed to infected pigs. There have been recorded cases of multiple people becoming sick after exposure to one or more infected pigs. The vast majority of human infections with variant influenza viruses is to not result to person spread.
When influenza viruses from different species infect pigs, the viruses can swap genes and new mixes of human, swine, or avian influenza viruses merge.
Many swine may have a sporadic disease or may show only mild to no symptoms of infection. That is why it is thought to be spread among swine, mostly through close contact and possibly contaminated objects, mostly between infected and uninfected pigs. Signs of H1N1 in pigs include fever, discharge of the eyes and nose, sneezing, breathing difficulties, and eye redness.
Humans can also transfer easily in large groups because it's an airborne virus. You're exposed within 6 feet of someone who's infected. It can also be transmitted through bodily fluids, such as coughing and or sneezing. Common signs and symptoms in humans are chills, fever, sore throat, migraine, weakness, and general discomfort. Now, a word from our sponsor.
Are you tired of your old, boring black shoes that you've had for like 6 years? Well, we have something for you. Then come on down to your nearest Vans and get your buy one get one half off. They come in all different colors and sizes.
Come get yours before it's too
The
late.
main question everyone is asking, what is the U.S. government doing to contain this virus? We do know for sure that they are taking precaution. As of right now, 2 laboratories in Atlanta, Georgia and Winnipeg, Canada have been working towards a cure since April.
The government has opened emergency response centers and passed an emergency declaration, where government frees more money for antibiotic drugs and gives previously unapproved drugs for kids to test. 1/4 of national stockpile of 50 million over-the-counter drugs will be released.
You too can help keep your community healthy by following these procedures. Covering your mouth when you sneeze or cough, wash your hands frequently, and when you're sick, stay away from people.
Researchers found that it spreads like any other seasonal flu, mainly in the winter. Seek urgent medical attention and stay away from others when you have difficulty breathing, severe vomiting, and when flu-like symptoms improve then come back worse.
Pregnant women are 6 times more likely to get the virus, as well as asthma, liver problems, blood disorders, kidney problems, and diabetes. People of the age 25 or younger are most likely the ones to get the virus. We have the stats of hospitalization cases and deaths between the months April and December. Between the ages of 0 and 17 years old, the mid-level range is 18 million cases. Between the ages of 18 and 64, the mid-level range is 32 million cases. The ages 65 and up, the mid-level range is 5 million, leaving a case total of 55 million.
Between the ages 0 and 17, the mid-level range for hospitalizations is 78,000. Between 18 and 64, the mid-level range for hospitalization is 145,000. Age 65 and up, the mid-level range for hospitalization is 20,000, leaving a total range of 246,000.
Between ages 0 and 17, the mid-level range of deaths is 1,180. Between ages 18 and 64, the mid-level of deaths is 8,629. Ages 65 and up, the mid-level of deaths is 1,360, leaving a total of deaths of 1,160 deaths.
In October, 2 vaccines were produced. One was a nasal spray and then a flu shot 2 weeks later. The nasal spray vaccine was for healthy individuals between the age of 2 through 24. The nasal spray vaccine contains a live virus that has been altered to hinder its ability to replicate in human tissue. People with a suppressed immune system should not get vaccinated with the nasal spray.
The second vaccine was made for ages from 6 months to the elderly. Both were approved by the Center of Disease Control after conducting multiple clinic trials, but researchers have noticed many symptoms.
Nasal spray symptoms are runny nose, low-grade fever, vomiting, headache, wheezing, coughing, and sore throat. Flu shot symptoms are soreness, redness, minor swelling at the shot site, muscle aches, low-grade fever, and nausea. These do not usually last more than 24 hours.
Also, most vaccines that contain flu viral products are cultivated in eggs, so individuals with the allergy to eggs should not get the vaccine unless tested and advised by their doctor that they are cleared to obtain it.
Good evening. I'm here with Bethany Jane, and we're going to ask her a couple of questions. Hi, Bethany.
Hi.
Have you heard about the recent outbreak of swine flu?
Yes.
Do you know anyone that has been affected with it?
My sister just was diagnosed with it.
Do you know how she got this?
Well, she travels on the subway every day, and we're not sure if that has something to do with it.
Have they done anything to treat it?
They gave her the nasal spray, but she keeps having reoccurring bacterial pneumonia.
Has this affected your daily life?
Yes, because everyone is afraid to come in contact with anyone, and I've recently wanted to travel out of the country, but they wanted to put me in quarantine.
Have you heard any cases where death was involved?
Well, where I live, there's been 2 deaths the past couple of weeks.
Since you have traveled, have you heard any precautions that other countries are taking?
I've heard that they are tempted to shut down certain airports, and in Mexico, where the outbreak started, they're making people wear masks and suggesting they stay inside.
Does this at all worry you about leaving the house?
No, because it's just a chance of somebody getting it with person-to-person contact.
Thank you for your time and answers, Bethany.
You're welcome.
After the break.
Reporting live with Emily Peterson. Can I ask a couple questions?
Sure.
Have you heard about the outbreak of the swine flu?
Of course I've heard about the outbreak.
Oh. Do you know anybody that has it?
Millions of people do.
Do you know how people catch it?
Isn't it from, like, eating pork or something?
Do you know the treatment?
I think there's a vaccine.
Do you know about any deaths?
There's millions of deaths. Hide your children!
Oh my. Hey, are you worried about leaving your house?
I rarely leave my house.
Okay, well, thank you for your time and answers.
I'll go now.
Most cases of swine flu being spread is through pig farmers or veterinarians.
Wait, my dad's a pig farmer, and my mom's a veterinarian. Can I get that?
Yes, both you and your parents are at high risk of catching this deadly disease.
Whoa. Then what am I supposed to do?
My best guess is probably for you to go to the hospital and get tested for it.
Oh, alright, I'll trust you.
Okay.
Alright, so we've pulled Isaiah here across from the hallway to ask you some questions. Is that okay with you?
Yeah.
Alright, do you know that the swine flu is becoming a pandemic?
What's a pandemic?
It's like a big spread of something. Like this virus known as the swine flu is going worldwide.
I did not know that.
What are you gonna do to keep yourself from catching this disease?
I'm gonna try and keep clean and sanitize more.
Alright, what are your takes on this? Like,
I think
what do you
that
think should be done?
I think that it's bad and Obama should do his job.
Fair enough.
Hi, welcome to Progressive. My name is Flo. What can I help you with?
I heard y'all covered everything. Is this true?
Yeah?
Well, I guess we'll have to test that.
Even this?
Even this?
Yepperdoodle.
Even this?
Yeah?
Even this?
Yes!
This is Bailey.
And Gabby.
And we're signing off.
You do it, 'cause I cleaned this morning. And I'll have to leave it, and then I have to put it on I'm gonna start pulling my hair out. You need to tap him because you're talking.
Yeah.
Just tap your back like this.
Okay, and you need to stand up so when you stand up, your face. Are you pooping? Jace. Okay. Jace, stop crying. Oh, you're not doing it. Dude. Dad, get out. An all-time high.
We have shocking new stats and reports about drastic measures.
Mixed.